My name is Dr. Nadeem Siddiqui. I'm the Executive Director of Clinical Services here at Winnunga Aboriginal Health Service. I'm coming up to about 2 years in the role. I was born and brought up in London, so I'm a bit of a POM that's come over to the land of Oz, land of Australia, and really it was the job. Julie enticed me to come over. She explained all the challenges that she's been facing at Winnunga and the challenges in general in Aboriginal health, and this was just a project I could not reject. I had to take it on, and it's been a really challenging role, exciting, many battle fronts, and I have a great boss in Julie Tongs to help guide the service, help guide me in terms of implementing the strategies that she wishes on behalf of the board in delivering the clinical services part of Winnunga. Well, that's a really interesting question. It was actually a question that I actually initially thought of before coming to Canberra, and when I spoke to Julie, she said it's in Canberra. I couldn't quite understand how that manifested itself until obviously arriving in Canberra and working at Winnunga. You don't see it in the streets and just around in the shopping malls, but there is certainly a disproportionateness of low socio-economic, vulnerable Aboriginal people here in Canberra, in the ACT. And what I would also say is that Winnunga doesn't just service Canberra, it's a regional centre. So we do get people coming from the outskirts of New South Wales as well. But certainly there is this disproportionateness. We represent 1 to 2% of the population. But if you look in the AMC, in terms of the prison service, in terms of child protection, in terms of chronic ailments, you multiply that by at least tenfold to about 20%, 25% representation. And what you're really dealing with here is not necessarily volume, but complexity. So when we're having to manage our clients and support them, you're not just dealing with diabetes, but you're dealing with socioeconomic issues, vulnerability, mental health issues, along with other physical ailments as well. And so it really becomes a very challenging environment, but really a genuine, earthy, realistic view of what it's like to be here in Canberra, in that vulnerable socioeconomic group. And we see it on a day-to-day basis. Being a professional, I'm used to lectures, seminars, reading lots of textbooks, but the best textbook in life, I feel, is what's on the ground on the day-to-day basis. You can see it in the staff, in our Aboriginal staff, you see it in the clients. And one of the great things about Winnunga is that it's a holistic health centre where we work with social health team. And social health team are our Aboriginal staff members who can advise us when it comes to managing our clients, what we need to do. They advise us in terms of the cultural aspects. And that is the great experience that I think most of us sometimes forget, that it's actually on the ground. And that was my biggest learning curve, is to be able to, and I think the only expectation that we want from our staff is that they are actively listening and wanting to really learn and understand, and not coming with a preconditioned viewpoint. And that's, I think, one of my sets of goals when I came, was to have this neutral and just really wanting to learn and understand and bring my generic skills in there and to help me on this journey of understanding. And I have a great role model in not only Julie Tongs as my boss, but also I would consider as a good friend and mentor. And I think that's really important for all staff to have that kind of mentorship that goes around, whether it's with fellow colleagues or with your supervisor or manager, and most importantly, with our clients. Their narratives are so important, and I'm educated on a daily basis by the stories that our clients give in that consultation room. And I feel very privileged and honoured that they allow me to be in a situation where I can listen to those narratives and get an understanding of people's lives, vulnerability, and for them to feel confident to expose that in a consultation room. So I feel very privileged, and I think all staff feel very privileged to be in such a situation.